Hello everyone, welcome back again once more to this specific lecture. We are going to look at the different concepts and principles of ethics. Okay, so these are the basic principles of ethics, and there are majorly 7 of them. Well, we have autonomy, we have beneficence, we have non-maleficence, and then we have justice, veracity, fidelity. Okay, so these are the different principles of quality, of ethics. Okay, so let us look at them and understand one at a time. So autonomy is the right to make a decision, giving your patient a right to make a decision of their own life or condition that they are presented with. So this is majorly the principle of consent, whereby you give your patient room to decide whether to take the treatment or not. And the number of steps that you need to give to your patients or procedures you need to give to your patient for them to be in position to consent to the treatment. Okay, you have to tell them what exactly they are suffering from. You have to tell them how it is going to benefit them, and if they don't maybe like take that specific treatment, what will happen to them. Okay, so what are the risks of taking or like not taking the treatment you're telling them, and then what are the benefits of them accepting the treatment you're telling them. So like giving them enough information so that they're in position to decide whether they should accept whatever you want to carry out on them, or they can deny, because they have a right to actually deny it. And then consent is defined as permission or agreement. Consent is a person's agreement to receive professional service or treatment appropriate for them, and will be based on both their presence and the values and the information with which they have been provided. That is consent. So you find that patients have a basic right to be involved in decision making about their own conditions. All right. And we see that what are some of the things that qualifies your consent to be a valid consent. We see that your patient should be in position or capable of making a particular decision, because we had a lecture on this channel where we looked at the dilemmas, and we said that in some countries a specific age is always considered to be like not in position to make a particular decision about or regarding their health. Why? Because they are young, okay, or they are considered as children. So in such cases, you find that you may need to get this consent from the guardian, the caretaker, and maybe someone else. And then acting voluntarily, that is, they must not be under pressure for them to make this decision. Okay, don't put them under pressure. Let them make this like on their own. All right, let them agree to whatever you're going to perform on them, not because you are pressuring them or you're giving them pressure. And then provided with sufficient information to enable them to make the decision. Should be capable of using and weighing up the information provided during the decision-making process. So what are the forms of consent? Consent may be obtained in the following ways. We have the explicit consent, where you can make it verbally or in writing. A patient can agree either verbally or in writing. In writing, of course, maybe when they are going to do surgery, you have to sign some form, all right? And also not only surgery, there are also other maybe examinations that they need to write down something. And then implied consent is when it indicates that their consent without writing or speaking. For example, a patient who brings their prescription to you for dispensing, you don't need to like ask them again whether you should give them the medication. Why? Because they are already like having a prescription, and they require your intervention or handling on what they have presented to you. And then we have a principle of confidentiality, and these are some of the duties of a confidentiality. This is another principle, okay? Making sure that your patient information is not shared anyhow, making sure that you protect the information of the patient gives to you. Some of them fail to consent because they fail to open up to you and maybe give you enough information about what they are exactly going through. And then in maybe because they are feeling insecure that you're going to share their information with maybe your workmates, maybe with so many people who know them. Yeah, so you find that you have to assure them that you are going to keep their information confidential. And by keeping that information confidential, you are protecting them because they have a right for you to keep the information confidential, not sharing their information unless it is in conditions that you really need to share the information. For example, if they're presented maybe with epidemic or a life-threatening condition that needs maybe alert of the society. For example, if they are presenting with Ebola, you find that it is a very crucial condition whereby if this information is not shared, other health workers who are going to work on her are not going to take precautions. And if they don't take precautions, it increases the spread of the disease. Okay, so that is duty of confidentiality. So we see that the confidential information that you need to keep confidential can include the personal details, information about the patient's medication, and then other information about patient's medical history. How about the principle of beneficence? That is a principle of doing good to your clients. Irrespective of who they are, do the right thing. Endeavor that you are protecting the safety of your patient. Do good to your patient. So you see that this specific principle looks at care that you offer to the patient and involves acting in accordance with the patient's welfare. Beneficence can be seen both as a principle and a religious virtue of compassion and helping others. We have another principle called non-maleficence. So beneficence is like doing good to others, doing good to all your patients, not only choosing some and then others you're doing harm to them. So this one is a principle of non-maleficence, which is not harming others. You're not harming your patient. This implies that if the practitioner is not technically competent to do something he or she should not carry it out. You are always encouraged to call a person who is working with you. If you cannot inject your patient, why would you inject in a wrong muscle or a wrong position just because you thought, or maybe you were fearing to inform your clients? I mean, to inform your workmates, yeah? So you don't have to do harm to your patient because you're going to harm this patient, you're going maybe to inject on the nerve, and once you inject on the nerve, it's going to bring about paralysis and yeah, so many things happen to your patient, and you find that you have done harm to the patient. The principle of justice. This is medically. Justice means treating similar kinds of people similarly. Like different types of people should be. Everyone requires fair treatment. Like you have to be fair when you're doing your work because all your patients require same treatment, all right? So this also involves not discriminating when you're offering the service. There should be transparency when you're offering this service, and there should be consistency. The other principle is the principle of veracity. Veracity is the principle of truth telling, like you have to tell the truth and be honest with your patient. Tell the patient the truth. What is it they are suffering from? Even if it is a chronic illness, tell them you're suffering from this and maybe the causes that might have led to that specific condition. Like a patient needs to know all this information. Okay. So in order for a person to make a full and rational choice, he or she must have the information relevant for his or her decisions. About fidelity is another principle. Do as you say, will do, plus respect and confidentiality. So this requires the loyalty, like whatever you say, are you loyal to it? Are you going to do what you say you do? Or you say it and then you don't accomplish it? All right. So those are the 6 principles of ethics or professional ethics. So we see that what are they? We have autonomy, we have confidentiality, we have beneficence, we have veracity, we have justice, okay, we have fidelity. So those are the principles, and by now you should be in position to answer any question that comes with or that comes asking for those different principles, and should be in position to give explanation plus maybe an example of your encounter that you got in the field of practice, and not only answering about when you're already in the field. For those who are already in the field practicing or carrying out these activities, we just have to enforce and make sure that we put them in practice. Okay, so professional code of conduct, we see that there are purposes for it, helps in taking decisions and responsibility. And then we look at public declaration of the principles and ethical standards which govern practitioners, and then it is a regulatory mechanism employed by any person employing the service, for example, pharmacy technician, and then also provides support and guidance, and then sets out the principles in accordance with which practitioners must act. All right, so that's what a professional code of conduct does. How about ethical misconduct? When you fail to do all these principles we are talking about, all the professional like conduct, that is classified now as ethical misconduct. For example, you're overcharging your patients. You find that you're not like doing right or justice. You are not loyal. You are not doing good to your patient, which goes to the principle of beneficence. Yeah, you're not doing good to your patient. You're causing harm by overcharging them. Some of them don't have the money. Okay, and even if they have the money, you don't have to overcharge them just because they have that money. Like, you have to do the justice on your patient. Yeah, so that is really necessary. So when you do that, it means you're not doing the right thing, and if you don't do the right thing, then that is classified as ethical misconduct. We also see disclosure of patient information. We have just talked about the principle of confidentiality. So you are breaching this principle of confidentiality because you are giving your patient information to everybody, or maybe to those who ask for it, or to your colleagues, even when you don't need to share the information. And then we also look at inappropriate behavior. For example, you're coming in for work when you're already drunk. So you're going to have so many medication errors because you yourself who is doing the work is not sober. Yeah, so you find that it is a misconduct. All right, you are not doing what you're supposed to do. By overdosing, you're not going to be just, you're not going to be loyal. And not only drug abuse, we also look at, not only drunkenness, we also look at drug abuse. Okay, so all that comes in. Having a romantic relationship with your patient, kindly, this is sexual harassment, and still you're not doing good to your patient, you're doing harm, which comes to the principle of non-maleficence, doing harm to the patient. Asking for incentives from patients and promoters. For example, your patients are coming in, you're asking them maybe to appreciate you for what you have done. Yeah, like patients have come and then they get better, they tell you next time they got better, and then you're asking them, since you're now better, maybe give me some money, or maybe you ask it indirectly. Those are incentives. Okay, maybe they bring for you they bring for you turkey for those rare birds. Maybe they bring for you matoke. You get the point. Yeah, so it is not the right thing. That is ethical misconduct. You did what you're supposed to do in the position that you were in. You don't have to get incentives from your patients. And then giving wrong information to the patient. A patient is suffering from this, or you've tested this specific condition, you're giving them another information. And then giving like wrong direction for medicine use. You're giving your patient wrong information on how they have to take the medicine or swallow the medication. Disrespecting your co-workers at work, you are not respecting people, you are doing so many other things or your own things. Areas of ethical considerations, we see that relating with other healthcare providers, we see that teamwork, advising, and respect shall not entice the patient. And then we also look at dispensing and sales of the drugs. That is, you should have the right information you're giving the patient. How about when you're prescribing, there should be a right drug for the right indication. In case it requires a referral, maybe when it should be referred, where are you referring this patient, and is it necessary for them to be referred? Okay. And then pharmaceutical care, looking at teamwork, and then always bear in mind that the obligations of preserving life, and you should always do the counseling. Okay. Relationship between professional colleagues. So we see that there are general guidelines to ensure that there is a good relationship, working relationship with your colleagues at work. You have to share knowledge with your colleagues, do what he or she can to promote medical knowledge, education, and research. Avoid any action which may be regarded as self laudatory, and then not condemn your colleagues. Okay, maintain the bond of fellowship amongst your colleagues, and then also shall not charge fees directly for attention to another medical practitioner. Pharmacy technician must not entice patients from his what? Colleagues. So that brings us to the end of this lecture. Thank you so much for listening. If it is your first time tuning to this channel and you have watched this channel or a specific lecture up to this end, kindly hit on that bell and then subscribe, like to the contents in this channel, because we have more coming up and taking us to greater heights. I wish you all the best. Thank you. Keep tuned. Stay blessed.